Hey guys, this is Dr. Today we'll look at the fractures of the necessity. So under this, the fractures of necessity, it basically means that which require the surgery for the management. So they include such as the lateral condyle fracture of the humerus. So lateral condyle fracture, and this is of the humerus. Next is the displaced fracture. So there can be the displaced fracture, and this is nothing but of the olecranon and also the patella. Then comes the fracture of the neck of the femur. There is fracture, and this is of the neck of femur. Next, even in terms of the Galeazzi fracture, in Galeazzi fracture, and this is nothing but the dislocation. Next is, it also is involved in the Monteggia fracture, Monteggia fractures, and this Monteggia fracture mainly in terms of the adults. And lastly, it is involved in the intra-articular fractures. So now let's recap. So we saw the fractures of the necessity. So they are nothing but the fractures which require a surgical management. So it involves the lateral condyle of the fracture of humerus, the displacement fracture of the olecranon or the patella. Next is there is a fracture of the neck of the femur. There is also the presence of the Galeazzi fracture. There is a displacement and the Monteggia fracture, mainly in the adults, as well as the intra-articular fracture. To learn and grow daily like this, please do subscribe.